going through all the editions of this textbook, what is the main progress or achievement you can find in this last edition?
Okay, 30% of the chapters are new. And by that I mean brand new authors on the chapters covering the same topics. 3 are chapters that have never been covered before, so a significant addition to the book. In addition, section 2 of the book has been completely modernized, and we now have a whole section on personalized medicine, recognizing the importance of that to cardiovascular medicine. There are over 2,600 figures in the book and 240 videos that are online. So really a tremendous overhaul of the book in the 10th edition, and we hope completely modernized.
How come you think this edition can be helpful for primary care specialists?
So that's a really great question, particularly in a very subspecialized book. So I think the importance of Braunwald's for primary care physicians, there's no book in cardiovascular medicine today where you can go and find everything that you need to do to take care of a patient. The book has been written to be the complete, definitive source of information. Practitioners can find the information very carefully. Another theme in the Braunwald series is that we carefully interlace the chapters, so there's always cross-referrals. So the entire book is written so that it refers to itself, and as I said, from a standpoint of a very busy private practitioner, they can go to one book and find all the information they need in one site, and it's all cross-referenced. So if there's something interesting about coronary disease while I'm reading about heart failure, I'll know the chapter to go do that. You can't get that off the internet. I mean, the internet is many times distracting because you get pulled in different directions. With the book, it's all very carefully integrated.
As a main author of this publication, what is your main goal when reviewing materials and content for the textbook?
So my main goal really is to try to put together a book that is readable, useful to busy practitioners and people who want to learn more about heart disease, and to make sure that it's current. The practice guidelines were changing as we were writing the book, and parts of the book that had been written earlier were no longer relevant. So we had to rewrite everything at the end to try to get all the pieces to fit together and to be absolutely current when the book was released.
And in this sense, what would you especially highlight from this text edition?
One of the major highlights would be the updates in the practice guidelines. Many of the practice guidelines were released. There were several practice guidelines, for example, in hypertension that were released. Our guidelines in the hypertension chapter actually synthesize the different guidelines and put them together in a coherent way and highlight the differences. So I think that's a major thing. Other things that we've done is to try to incorporate some of the information on genetics that's appropriate for clinicians within each chapter. Before, we used to have separate chapters in genetics. Now all the information on genetic testing, when appropriate, is in the individual chapter, I think making it easier for the doctors to understand.
Talking about the specialty, about cardiology, in the following years, which areas are most likely to make progress from your point of view?
So I think there's been an explosion in the field of valvular heart disease. That's very adequately covered in the wonderful chapter by Dr. Bono and Otto. There's been a lot of progress in terms of heart failure, and the heart failure chapters that I was personally responsible for editing cover all of those new additions, including the important role of biomarkers. Many changes in the field of atherosclerosis, the emergence of these so-called PCSK9 inhibitors, they're covered in the book, and then recent changes in terms of the guidelines and how clinicians should think about treating patients for primary prevention, all covered in there.
Which were your first thoughts when you received the invitation to collaborate in this publication?
That's a really emotional question for me. So the first edition of Braunwald's heart disease led me to become a cardiologist. I was thinking of either neurology, nephrology, or cardiology. And when I read the first edition of Braunwald's, I said, this is what I want to be. So when they called me for the 8th edition to join the team, because Dr. Braunwald was going to step down, I was one, totally humbled because the book had meant so much to me. Two, I just saw this as a wonderful opportunity to make a contribution, much in the way that that book has made a contribution to our field. really for the last 50 years. So I was very emotionally, it was humbling, I think, to be asked to join the team, and also very exciting. I think it's been a great opportunity. I've really enjoyed working with the editors. Elsevier is a tremendous company to work with, but we've had so much input from people all over the world who read the book, who love the book, who tell us how to make the book better. And that's also been one of the gratifying things, is to become connected with readers worldwide who find Braunwald's to be one of the definitive sources in cardiology. So very humbling. Regarding
Spanish language cardiologists, do you have any reference about this language in cardiology?
Many of the fundamental contributions to cardiology actually came from Mexico and South America. So I've always been a fan of the cardiology community there.
And going through Spain, and do you think there are any cardiological issues coming from the Spanish language countries that can be an example for the specialty?
Well, I think one of the great cardiologists in the world today, Dr. Valentin Fuster, who's editor for the Journal of the American Cardiology, is a very prominent cardiologist in our country, but spends a lot of time in Spain. But he's one of my role models and a fantastic cardiologist.
Okay, so thank you very much for attending us, and good morning. Thank you very much.
Good morning. All right. Thank you.
Bye-bye.